Okay, this is going to be the third lecture for the February 8th, 2014 Paramedic Refresher for Trotwood Fire and Rescue. We're going to cover SIDS and a little bit of CISD, so the sudden infant death syndrome and the critical incident stress debriefing that goes along with taking care of a pediatric patient that is ill. So sudden infant death syndrome is defined as the sudden death of an infant where thorough postpartum fails to reveal the cause. So in other words, the baby dies, but they just can't find a reason for it. Remember that SIDS is about 2 to 3 deaths for every 1,000 live births. It is the number one cause of death for the pediatric population between the age of 1 week to 1 year. It's 90% occur at 1 month to 6 months, and it's very rare in the first few weeks of life. So, higher than what you think. However, it is fairly rare in the first few weeks of life. They found that it's a lot more common in the the winter time, in the male population, and mothers that were young, children that had a low birth weight, and anytime there's multiple births. More common in lower socioeconomic groups. It's more common in the African American or black population and also Native American, and then in the maternal and drug cigarette use. So these are, all things that we deal with, in the city of Trotwood. Unfortunately, we are in a lower socioeconomic climate. Majority of our population in the city of Trotwood is African American, and we have a lot of, pregnant females that, they don't get it. Unfortunately, they still, take drugs, they still smoke, they still drink, and just not taking care of the baby themselves, not getting good gestational care and prenatal care. So it says 50% have a history of a cold in a week before the death. So, that could be RSV, it could be a number of different things, but statistically they say about 50% had a history of a cold in a week before their death. So they're not sure. It could be due to chronic hypoxia, sleep apnea, pharyngeal obstruction during their sleep, increased carbon dioxide levels in their microenvironment created by the infant sleeping in a prone position. So, that's why it's no different than us saying, don't put a patient that's handcuffed behind their back, don't put them prone. You want to make sure that they're supine and don't leave their hands behind their back. So if you put a kid on, in the prone position on their belly, then the potential of them actually having increased carbon dioxide levels and the potential for death. So SIDS is not an external suffocation. It is not a result of aspiration, child abuse, heredity, or caused by a cow milk allergy. As much as anybody would want to tell you that's what it's caused from, that's not what it's caused from. They have no idea what causes it. It's a number of different things that go into it, but essentially they still, after all these years, have not figured out really what causes sudden infant death syndrome. It says it can't be predicted or prevented, and it's obviously always fatal. That's why it's called sudden infant death syndrome. So it's always fatal. So things we need to look for is a normal nutrition, hydration. Make sure that the baby's, their fontanelle's not sunken. Make sure their eyes aren't sunken. Make sure that they're actually getting good nutrition. They're getting enough bottles per day. Fluid in and around their mouth and nostrils may be blood tinged. They may have livor mortis or rigor mortis. So if they have the rigor mortis, obviously, they're going to be stiff. Liver mortis would be like the dependent lividity. Rumpled bedclothes and that squashed nose appearance. If you've ever seen the squashed nose appearance, essentially that's where the baby, lays on their belly and the pressure on their nose kind of pushes their nose down and makes it look like it's a squashed nose. So, for us, appropriate care for the infant, support for the family, and the crisis intervention for the EMS personnel. Once again, it's always fatal. If you go on a child not breathing that is a SIDS, they're going to be dead. And the biggest thing for us is to, in turn, we need to make sure we support the family. So, aggressive resuscitation unless the signs of irreversible death present. Biggest thing is going to be paternal reaction and the agency policy. For us, we leave the children where they're at. We try not to disturb the scene. We ask for the police if we have to. If we're going in on, a child not breathing or whatever, make sure that you dispatch the police in addition to you. Just because if you do get in there and it ends up being a SIDS and the parents start freaking out and they want you to transport, at that point it could be a crime scene, and we don't want to disturb the baby, because as soon as you pick them up, you just destroyed any kind of evidence that if it was a crime scene and it was a homicide, you've just messed all that up. So that's why you always want to make sure the police are dispatched along with you. And it says a true SIDS cannot be resuscitated. So, support for the parents and siblings says ask for and use the infant's name. Make sure you use a calm, unauthoritative manner. Very structured information. It says stress that nothing could have been done to prevent an event. In other words, you don't want them to feel guilty, because they start feeling guilty, that causes problems. They start getting survivor's guilt, whatever it may be. They think that they caused this, or if they could have done something different, or if they'd only done this, if they'd only changed their diaper, if they would only given them one more bottle, if they wouldn't have taken them out to the cold, if they wouldn't have taken them to see grandma, if they wouldn't have let anybody come over to see them, all these things are going to run through their head. The biggest thing for us is just make sure you stress to them that there was nothing that could have been done to prevent the event. Expected grief reactions. We still, we get the 80-year-old grandma or grandpa that passes away, and their kids come over that are 60 years old, and they're just losing it. Obviously they're very grief stricken. Now, let's talk about a parent that just lost their 3-month-old. They were fine, they went to bed awake, and they essentially they wake up and they find the baby dead. This is an act as an advocate for the family. If there's nobody there and they need somebody called, ask. If they need something done, ask. If they need a funeral home called, ask. These are all different things. You need to make sure that you act as the advocate for the family. This is by far probably the worst day of their lives, and our job is to make sure that it is as pain-free as possible. So crisis intervention for the EMS personnel, make sure we acknowledge the impact, prepare through the training, we know our limits, and we use the critical incident stress management team if needed. So for us, you got to acknowledge the impact. Not everybody reacts the same. Essentially, I may be able to, take it, it's fine, take it in stride, everybody dies, so on and so forth, and the person right next to me may just, they're losing it, and they can't keep it together, because everybody gets affected differently. So that's why we need to make sure that, one, we prepare through training. In other words, we always make sure that we're ready, make sure everybody's prepared, make sure we know what our limits are, and then, if we have to, we'll call that critical incident stress management team. We get a hold of them, let them come out. They're people that are from outside our area. They come in and basically let us talk. And it may just be a build-up thing. This may be your, third full arrest, in the last 2 weeks, and you had, 2 adults, and now you have a baby. Or, maybe this is your first SIDS death. Maybe this is your 10th SIDS, whatever, and it's just a accumulation of all the problems. So just be aware of that, and not only for yourself, but also for your partners. Okay, we'll go over child abuse and cover that. All right, so different definitions of abuse. We've got physical, emotional, sexual, the maltreatment of the child resulting from the acts of omission or commission by the parent, guardian, or other caretaker. So neglect. It's a failure to provide for the child's needs, although support services are available. So this is, not getting them food, not, putting them in school, letting them wear dirty clothes, not changing their diaper, not giving them a bottle. It's about 1 million cases per year. Out of those 1 million, about 4,000 are fatalities, 10% are traumas, and typically you see about less than 3-year-olds seen in the ER. So 10% of the traumas, less than 3-year-old seen in the ER. So, and it does not matter your social, your economic, your religious, your ethnic groups. It doesn't matter. I was just watching a TV show the other day that had two kids on there that were billionaires. Their family were billionaires, and these kids got locked in the closet for like days. They would go to school. Nobody knew there was any problems. They go home and they literally would get beat and get thrown into a room. They would get locked in the room for like the whole entire weekend at a time. Sometimes, during the summer they get locked in there for like a week or two. So it doesn't matter what your socioeconomic status is. Abuse happens. So, some contributing factors. So, kids just being different. So, like handicap, hyperactive, precocious. So, whether they're in a wheelchair, they're using crutches. ADHD kids, kids that are autistic, and then just precocious kids. So, female to male, it's about 2 to 1. So, about for every 2 males, there's 1 female that actually suffers abuse. Small enough to be unlikely to retaliate, and about 2/3 are less than the age of 3 years old. And that's because they're so small they're not able to fight back. They're not able to tell anybody. So contributing factor for the abuser, it's often abuse themselves as a child. They usually are lonely, unhappy, or under stress. They lack the understanding of normal child development. They have a lack of support. The spouse often non-supportive, or the extended family support is unavailable. So maybe they live out of state, or maybe they are estranged from their family. So now you've got a spouse that's non-supportive, whether it's the male that's non-supportive or the female that's non-supportive towards the other caregiver. And without that extended family for support, these people typically, they just crack and they can't take it anymore. And they take it out on the children. So, contributing factor, so poverty, job loss, marital conflict, and any kind of illness producing uncontrollable crying. So multiple repeated injuries, so unusual variety, different stages of healing, and unusual locations. So those are things you have to look at. So if they say, he fell off his bicycle, and we're looking at him, he's got some scratches on his head, but then, he's got bruising across his abdomen, or he's got, a handprint across his back, or he's got what looks like, lashes across their back or their butt or the back of their legs. These are all indicators that the child may be being abused. Then inconsistency of the injury. Once again, the reported mechanism. I talked about one of our local fire departments. When the battalion chief got there, they got called for the child that fell down the steps, and he basically called the mother, a liar, and he was right. The kid just had too many injuries in order to really be consistent with the story that they were telling. So find out the history and then any kind of developmental abilities with the child. So the history changes on the retelling. So each time they tell the story, it's something different. It's never consistent. The child has had multiple ER visits or EMS contacts. So they've called 911 and maybe removed them several times, or they've taken them to the ER on their own. So inappropriate parental response, prolonged delay in seeking the help. He fell a couple days ago, or you see old bruising, you see the yellow bruises, and or something major, and the parents never took care of it. So the parents hostile, indifferent, or apathetic. So in other words, they really don't care. They're kind of indifferent about the injury itself, or they're hostile towards you when you start asking them just simple questions. They start becoming very defensive. It says person other than the caregiver brings a child in. So, they live with mom and dad, but grandma or grandpa brings them in. Or they live with mom and dad, and the 17-year-old sister or brother brings them in. And you ask where the parents are, and, they're at home. So, definitely an indicator of abuse. So, malnutrition, poor hygiene, inappropriate dress. So, you get the kid that's emaciated. Ribs are showing, they look sick, they don't brush their teeth, they don't brush their hair, their clothes are all crumpled and look horrible, or maybe their clothes are mismatched, their shoes have holes in them, or their socks are mismatched, a number of different factors. These all could be indicators of abuse themselves. Okay, so the child is apathetic. In other words, the kid shows no emotion. Something that my 7-year-old would be bawling about. You've got a 5-year-old or a 4-year-old that's just stoic, or what you think is stoic, and they're not. Typically it's just because they're abused. And then extremely fearful of the adults, and they're unusually loving or cooperative. So get the child out of the abusing environment. Make sure you repeat the suspicion to the ER physicians. You have to document thoroughly. You have to report. That is mandatory. You have no choice. And civil immunity if reported in good faith. In other words, if you don't report it, you are held criminally liable. If you do report it and you are wrong, you have civil immunity because, in good faith, you thought you were doing the right thing, or you thought that you were right because of these different factors. It's been held up in court several different times, so you do have civil immunity as long as you report it. It's when you don't report it and there is a problem. So, typically with the SIDS victim versus a child abuse or neglect victim. SIDS victims, they have no external signs of injury. They have normal postmortem changes. Other siblings all appear healthy, and the history of the child being well when they were put to sleep. The abuse neglect victim, typically you'll see external signs of injury. A lot of times they'll look malnourished or emaciated. Siblings may show the signs of abuse or neglect, so other kids have it. And their story is evasive and it just doesn't sound right. In other words, they're dodging your questions when you ask them, and things just aren't adding up. So it's kind of one of those gut feeling things. All right, so for pediatric critical incident stress, so this is when we run into, a pediatric patient, what we're going to do or what we should be doing in terms of a critical incident stress debriefing. So times we may have to have a pediatric critical incident stress debriefing, death of a child, a prolonged rescue, especially if the child dies. So if we're watching a kid, slowly dwindling away and getting sick or die, that waits till you're conscious. Oh, pardon me. So child abuse, mutilation, you watch the kid, have a body part chopped off or cut off, or you see them getting cut, or cigarette burns, or coffee, or an iron, or you watch them, get dropped into a hot tub and they have sloughing skin. Intense media coverage, that's a real big one. You have something that's a high profile issue, and you get the media that's breathing down your throat. That can weigh very heavy on your conscience. It can make you very ill. So, and then identification with the victim. In other words, you know who the victim is, or in turn, you just took care of a 7-year-old that died, and now you relate that back to your 7-year-old, your 8-year-old at home. That's a pretty big deal. So, trying to separate yourself, it's fairly difficult sometimes. All right, so acute critical incident stress reactions. Physically, fatigue, nausea, tremors, or sweating. All of those a lot of times are just the signs and symptoms of depression. They can have chills, dizziness, and some kind of shock symptoms. So they may have a memory loss, decision-making difficulty, the concentration lapses. They have a difficulty setting priorities, insomnia or dyscalculia. Maybe anxious, fear. They have hopelessness or that sense of grief, anger, irritability, depression. Typically, this is about 85% occur in the first 24 hours, and then 50% in the last 3 weeks or longer. So if you start having some kind of a stressful incident, typically it'll start coming out in about the first 24 hours, and then it dwindles away the longer it takes. It says it lasts about 3 weeks or longer. So untreated reactions can progress to post-traumatic stress disorder. So we need to make sure that we are aware of that, that we don't want them to get PTSD, because that's the last thing you need, number one, to That's something that actually they can retire off of, and we want people to have a long history and a long career and not have to go out early. So during the emergency, make sure we warn incoming crews, maintain proficiency and confidence, reduce stress, get people having reactions off the scene. We accept limitations, and we always make sure we use breathing control techniques. So when we start getting excited, um, we need to make sure that we control our breathing, because that helps us stay calm. And we need to make sure that we let's just get people having reactions off the scene. So you have somebody that's flailing, my baby, or flipping out, get them off the scene or get them away, because that just adds undue stress to you. All right, so following an emergency, make sure that you it says diffuse as early as possible. Debriefing within 24 to 72 hours. Physical exercise reduces their stress. Make sure you avoid any kind of sugar or caffeinated beverages. So it's okay to cry. There's no doubt about that. Whether you relate it to your kid, whether this is your first call, whether this is your 100th, pediatric patient, to me it doesn't get any easier. It's okay to cry. That's human nature, and that's a normal reaction. And make sure you take care of the spouses and families too. You take your mental baggage home. You drag it around. If you think your spouse or your family doesn't notice that stuff, you're wrong. Make sure that you take care of them too, because the more you take care of them, the more they're going to take care of you. If you neglect them, they're going to neglect you when you're in your time of need. So, all right, that is the end of that lecture.